Welcome to the best of Central Florida. I am Justin Clark. I will never forget the year was 2002. I was in law school in Boston, hanging out at the Beantown pub to be exact. A classmate comes over, introduces himself. He said he was from Orlando. I was shocked. I thought Orlando was theme parks, chain restaurants, maybe a water park or two. Who would have thought that now 20 years later I would have lived here for 15 of them? Who would have thought I would raise my two little girls here? Who would have thought I would fall in love with Central Florida? It's a hidden gem. From the great restaurants, sports teams, booming art scene, the Wekiva River, the beaches, and yes, even the theme parks. From Winter Park to Winter Springs, Ocala to Oviedo, this is the best of Central Florida. A very special show today as we visit the top dermatologist in Central Florida. Might I add, it could be a life-changing show for some of those out there like me who have not been to a dermatologist before. I think after today I will be visiting the dermatologist. Bring in the beautiful Michaela Nichols as always. Michaela, you do have experience with dermatologists.
Yeah, going to them often, just because I guess my skin doesn't like the sun, as most people's don't.
How often do you go?
I'd say probably like every 6 months. I try to keep on it just because my family has history of melanoma. So obviously this episode means a lot to me. Just early detection is key.
It's going to mean a lot to you when we get to the end as well, when I have a very special surprise for Michaela at the end. She has no idea what it may be, but I got to tell you, it's a pretty important surprise. Any guesses?
No, that scares me a little bit.
Why?
I don't know, because is it a puppy? Do I get another puppy?
No dogs on the set. No one's going to dump water on you. I think you'll be very, very surprised. I think you'll be very happy at the end of the show.
All right, guess we'll find out.
I also have something for you. Our good friends at F&D, the restaurant group here in town, have given us not one, but 6 $50 gift cards that we're going to give to you at the end of the show today as well. I think this is going to be a great one, Michaela. I think it's an important show. We can talk about pizza, we can talk about beer, but this can be life-changing stuff. I mean, this is talking about the difference in catching something early, getting it removed easily versus maybe catching something too late. So I certainly hope that you will stick around. Michaela, are you ready?
I'm ready, Justin.
You might have to help me with this too, because you know so much about dermatology, and I don't
I'm not
necessarily.
like an expert, I just go often.
Yeah, exactly. Well, here's what we're going to do. We're going to take a quick break, but when we return, the best dermatologist in Central Florida. You have spoken. The people have spoken. People's choice for best dermatologist in Central Florida goes to our good friends at Advanced Dermatology and Cosmetic Surgery. Pleased to be welcomed right now by two of their great physicians there, Dr. Christine Moorhead, Dr. Savina Aneja. Ladies, how are you?
Great, thanks for having us.
I feel a little intimidated, honestly. I went to law school and all, yeah, but two doctors next to me. I feel like I have so much to ask you. Should I be intimidated or no?
Absolutely not.
No, really? Are you intimidated?
A little bit.
A little bit, too. So let me start with this. Florida, we have a lot of sun. It's hot here. People are outside here. You hear about, if you're 25, you should go to the dermatologist. There's 35, but they're talking about people from Michigan, people versus Florida. It's a little different for us here, would you say?
Sure, for sure. In Florida, we do a lot of activities. We're exposed to a lot more sun. So from a young age, people are in the sun doing water sports, doing outdoor activities all throughout the year. And so we do want all of our adult patients to come in for total body skin checks, but we do want younger patients who are higher risk to come in as well. So if you have a family history of melanoma, a personal history of skin cancer, if you've had any kind of tanning bed use, blistering sunburns in childhood, we definitely want to see you in sooner so we can take a look at your skin closely.
Weird question, I know, but a lot of people have a primary care physician. Not everyone has a dermatologist that they know to go to. Do I go straight to you? Do I call your number? Do I go to your website, or do I go through my PCP? What do you think?
Well, it depends.
Yeah.
Some patients come directly to the dermatologist. Some people need a referral from their primary doctor, in which case you may stop there first.
Got it.
But what's interesting is one of the physicians in our group, Dr. Cotter, he recently published a study that shows that dermatology skin checks are actually 23 times more sensitive at picking up skin cancer as opposed to like pap smears for cervical
Really?
cancer. So we know that skin cancer screenings are really effective at catching skin cancer, and there's a lot of value in catching a skin cancer early, because when we catch a skin cancer when it's a stage 0 or a stage 1, we have a lot more therapeutic options and we have a lot less downtime in terms of recovery. So we definitely want to catch skin cancers early.
I mean, skin's pretty important, and it's exposed all the time to this sun. Is there an age where I need to really do some progressive action against this, or do I just wait till something happens? When do I call you, Dr. Moorhead?
Well, I think that you're never too young to start doing something, wearing sunscreen, wearing protective clothing. But again, like Dr. Aneja said, it really depends on your history. We recommend all adults come in for an annual skin cancer, total body skin cancer exam. And you know, like she said, the earlier we catch it, the better.
You know, and this is totally true. I've heard so many people come up to me and say that you guys are the best. Advanced is the best. Why is everyone telling me that?
Well, we are a large group, and because of that, we can all follow our passion. I'm a Mohs surgeon. I trained and did a fellowship in Mohs surgery, and so that is what I do. But I have colleagues like Dr. Aneja who specialize in general dermatology as well as cosmetic, and because of that, we're still offering comprehensive care, but we get to follow our passions.
What is this Mohs surgery? I know you have some specialization in that as well. Mohs, what is that?
So it's kind of the gold standard technique for removing skin cancer, and mainly the non-melanoma types, basal cell carcinoma, squamous cell carcinoma, and it's a technique that allows us to remove the skin cancer with the highest cure rate, but take out the smallest amount of tissue. So generally, if somebody were to have an excision, we would mark where we see the skin cancer. We would take a pretty good sized border of normal skin around it. But since I'm going to check the skin, that cancer while the patient waits, I can take a border of maybe 1 to 2 millimeters.
Wow.
While the patient waits, we analyze it under the microscope. If I saw that there was still a small amount at one edge, take a little bit more, check it again, and we keep going until we get it all out.
Unbelievable. So what all dermatology services do you offer?
At our group, because we have so many locations, we really do consider ourselves to be expert in skin, hair, and nails.
Oh, wow.
And so for patients who have skin cancer, we obviously have most fellowship-trained surgeons like Dr. Moorhead, but we have other experts in skin rashes like psoriasis, experts in acne, experts in allergy testing, experts in hair loss and hair restoration. And so we feel like we have a comprehensive team that can address all of your skin, hair, nail needs and concerns. At our Lee Road Aesthetic Center, we also do a fair number of cosmetic and aesthetic treatments that help patients who are interested in facial rejuvenation, improvement in wrinkles, fine lines, textures. We also have some newer therapeutics that are directed at body contouring and fat loss.
Wow.
So many things.
I'm 41 years old. Should I be doing an annual skin examination?
Definitely.
I got to get in there. What's the best way? Let's say I'm skipping my primary care. I want to call you directly. What is the best way to schedule an appointment?
So if you go to our website, it's probably the easiest,
Yep.
advancedderm.com. It will even show you on the website if there is a same day or next day appointment in your area, and then also the phone number's on there.
Got it. Awesome. Dr. Christine Moorhead, Dr. Savina Aneja, thank you so much, guys. That was great stuff.
Thank you.
Do yourself a favor, call them right now, and you got to get this annual screening. It's easy. They've made it less invasive, and I know the good people at Advance are fantastic at what they do. We need to get in there. We need to get our skin checked,
I go for my skin
right?
checks all the time.
How often do you go?
More than normal people. Normal people is not a thing. More than the most.
And no joke at all. I know that many of you are probably like me. We don't love going to the doctor. After today, I've convinced myself that I'm going to get my skin checked, because if you wait too long, it can be too late. That's the problem. Here's what we're going to do. Quick break. When we return, Justin's Choice is right ahead. And finally, it's time for my favorite portion of the show. It's time for Justin's Choice, and pleased to announce today Justin's Choice for Best Dermatologist in Central Florida goes to our good buddy, Dr. Johnny Gergen. Dr. Gergen, welcome to the show. How are you today?
I'm doing great. Thanks for having me.
Board certified in both dermatology and Mohs surgery. What does that mean exactly?
It means that I finished a residency in dermatology and did all the preparations as well as the examinations to be board certified. Then I went ahead and did a second certification in Mohs procedure.
Got it. Now, we live in Florida. Obviously, the sun can be a little bit rough down here. Is there a certain amount of time? Is there a maximum amount of time I should sit at the beach? Is there a maximum amount of time that I should be outside? Or how does it work?
We usually recommend avoiding sun as much as possible,
Really?
especially during the midday. And if you have to be out there, using a sunscreen, preferably with physical sun blockers.
Yeah. Is there a certain, what is it, SPF or something? Is that what?
Yeah, I've heard like 30 is the best.
30 is where you're going to get the most benefit for what you're paying for. When you start going up higher to 80, 90, you start paying a lot more, and the benefit is minimal after that.
Right.
What's most important is to stay with the physical sun blockers, which when you look at the active ingredients, you want to look for zinc or titanium.
Okay, got it.
That's usually the best.
I know you have offices both in the Villages and Leesburg, but I think that for the right patient, especially when it comes to a specialty, you're looking for a doctor that specializes in dermatology like you do, you travel for that right doctor, do you not?
Yes, I do have a lot of patients that come from all over Florida, as well as out from other states all over the country.
I heard a little rumor that maybe you have other physicians that might even fly down here to see you because they trust you as your dermatologist. Is that right?
I have a few physicians that fly from different states for me to perform the Mohs surgery on them.
I mean, that's got to be the ultimate sign of respect. You know, that's like me having lawyers hire me to do their legal work, I guess, because we're talking about doctors, trained doctors who are coming to see you. I think that says all you need to know about Dr. Gergen and his practice, right?
Well, thank you.
So Michaela has like a triangle here, right? Well, we were talking about it pre-show, and you say you can't tan the triangle.
No, it's weird.
What? Any idea what would cause that?
Yeah, it's a condition called pityriasis alba, where she's unable to tan in that area, and it's usually permanent.
Is that right?
Yeah.
Dang it.
So is this a lot of people have that issue, or what?
No, it's not a lot of people. It's usually you see sometimes in kids and first onset. Yes.
When it comes to being a physician, being a surgeon like you are, how important do you think your bedside manner is to me as a patient and really getting the best results I can get? How is bedside manner really important?
It is. It's probably the most important thing in my field. To be able to take the time with your patients to speak to them, answer all questions, and as well as to be able to relate to all different kinds of patients with different backgrounds.
How bad, I guess you would say, was the whole tanning bed explosion of, what is it, the 1990s? I don't know. I mean,
even now.
Is it still like that now?
Yeah, okay. Especially for us, you know, when I was in college, that was like the thing to do, was just go to the tanning bed.
Yeah. How bad, how busy did that make you now, 20 years later, that people were going to the tanning bed so much back in the day, and apparently still now? I just didn't know that.
Yeah, that's one of the things I hate, to be busy that way.
Yeah.
Tanning beds are one of the most dangerous things you could do. It's actually more dangerous than going out in regular sunlight.
Is that right?
It increases your chances of melanoma dramatically, and we definitely do not want to see any patients with melanoma.
That's right.
We try to avoid it as much as possible.
You know, maybe the easiest way to avoid it, or at least to not have major complications, is obviously to get a skin tested and find it early. Is there a certain age where someone, or Floridians in general, should really go get a 6-month or a yearly skin examination?
Everyone should get a skin exam, even beginning at the age of 20s.
Really?
Because we have seen melanoma cases at the age of 20s. Other skin cancers, non-melanoma skin cancers, they do come up later in life for most people, but I have seen that as early as in the 30s.
How often do you get tested?
Often, because
Like,
I've had a few,
often?
what are they, biopsies? Yeah, and then I have like a little one, I think it was a punch, right? The punch technique. Yeah, on my back. Not proud of it, but often. Because,
So how often? Like once a month? Once every 6 months?
No, like 6 months, I think. 6 months I try.
6 months.
What goes into that? Are you digging something into me, or is this just an examination?
The first initial...
Not that I'm scared, I just want to make sure what I'm signing up for.
Initial approach is to examine the patient. We usually look at everything on the skin. We look at all the moles and all the growths. And then if we see something suspicious, at that point we biopsy it.
Got it. And that's obviously what you hope to not find, but then the earlier you find it, I imagine, the better.
The early detection is the key in skin cancer. Just like in any other cancer, early detection is vital.
I know that you are board certified, as I mentioned earlier, in the Mohs procedure, the Mohs surgery. They've made it a lot of advancements, I would say, when it comes to dealing with skin cancer. Describe this Mohs procedure.
The Mohs procedure is the most technically advanced procedure for removing skin cancers. It's mostly utilized in the face. We actually take a little bit of tissue at a time without large margins. It enables us to keep the defect small as possible, so the cosmetic outcomes are superior to anything else. And also, we check it in real time during the procedure. It's an outpatient procedure, and we check the margins right there and then. So when the cancer is removed, it's completely gone, and before we close the patient up.
Let's say that I feel like maybe something's going on with my skin. I want to come see Dr. Gergen at either office. How do I get to you? Do I call you directly? Do I need to go through a primary care physician? How do I get to come see you? You
don't need a referral to see a dermatologist. We usually just straight up call and make an appointment.
Right. And get right in there, huh? Wow, what a great job you're doing up there. And again, this is not just for those of you in the Villages or Leesburg. If to see the right guy when it comes to dermatology, I would go from anywhere, certainly an hour viewing audience. I mean, it's kind of a no-brainer to see the top of the top. Excellent job, Dr. Gergen.
Thank you.
What's a good phone number or website for you?
Phone number is area code 352-435-7695. And the website is www.drgergen.com.
Well, we're actually going to tour his facility on Monday. I'm looking forward to that. And you're going to hear from Dr. Gergen over the next few weeks about what you should do dermatologically. Is that the right word? Dermatologically?
Yes. Wow,
I'm just making sure.
Yeah.
That is right. I did right?
Yeah.
Awesome. I'm so proud of myself. Dr. Gergen, excellent job today as always. Thank you. Keep up the good work. Michaela, a little special surprise for you guys after this quick break, okay? I'm giving you compliments of our good friends at F&D. You know the restaurants, F&D. We have 6 different $50 gift cards. We'll do it after this quick break as Best of Central Florida continues. Exciting show news I wanted to tell you about today. So when we started this show a couple months ago, it was really me, Phil, Tyson, and something came up and I was asking Phil, I said, hey, do you know anyone who would want to be a critic on the show? I was thinking, I don't know, 30 seconds to a minute of this critic coming on the show and telling me about their favorite restaurant or favorite business. But the news today that I have to share with you is when we see you next week, which by the way, hit record series now, when we see you next week, this is going to say, with Justin Clark and Michaela Nichols. And it's because you've done such a great job.
Thanks, Justin.
We wanted to include you in the name of the show. So thank you for all that you're doing here, and really for the people of Central Florida getting to see you every week. They love you. So
thank you. I'm excited.
The show now is Best of Central Florida with Justin Clark and Michaela Nichols.
Super cool.
What better way to celebrate than give you stuff, huh? Here's what we're going to do. If you follow Best of Central Florida on our Facebook or Instagram page, send the message, I love Michaela.
Wow.
And I have not one, not two, but 6 $50 gift cards from our good friends at F&D Restaurant Group. It's F&D Wood-Fired Kitchen, F&D Italian Kitchen, F&D Cantina. 6 different $50 gift cards. All you have to do is text, I love Michaela, to the Best of Central Florida Facebook or Instagram page. And how are we going to give them out? Are you gonna do it, or can you at least? I'm putting your name on the show. Can you please
I could do something, right? We'll go through and we'll decide randomly. So no favorites, right? And, we'll reach out to you, and our lovely friend Kayla will probably do that. So thanks, Kayla. Kayla gets a shout out today because she is awesome. Kayla, Michaela, we got a cool team.
So it was an important show today, dermatology, and we're talking about maybe the first show we've done that really could be life-changing for some people. So really, from my heart, I would tell you, anything over the age of 25 or so, it is going to help you to get this very simple skin test once a year, maybe, and it takes 5 minutes. I would go see one of our great doctors who are on the show today to get that skin test. The last thing we want to do is make something that should be fairly simple to solve a really major medical problem for you, and that's why we wanted to do Best Dermatologist today. So I certainly hope, if nothing else, you're going to now go get that skin test at least once a year. Michaela, had you not been doing it,
yeah.
I mean,
it could be a big problem. Yeah, I have to go and get them often, like I said earlier. And you know, Justin, I've been getting them since I was like a little girl.
Really?
So yeah, I mean, little. So it's never too early to start.
Because you were kind of fair-skinned or whatever?
Yeah, and we have like a history of like melanoma in my family, so it's never too early. I think, at least.
I mean, I'm not afraid to admit I have, for one, never been, but I assure you, I'm going to go now. Now, I don't have a triangle though on my stomach.
The
so
triangle.
That's the weird part for me. So you can't tan it at all.
No,
it's
I guess
untannable.
not. It's untannable.
I mean, couldn't it have been your initials or something?
I wish. That would have been really cool.
Oh, man. Next week, here's what we're going to do for you. And again, I want to give you these gift cards. Go to our Facebook or Instagram, Best of Central Florida. Send in I Love Michaela, and we're going to give away these 6 different gift cards to F&D. But next week is Best Beauty and Fitness, I think. It's going to be an awesome show next week for you as well. If you know anyone that's in the fitness beauty industry, send us their information. If you think they are the best of the best, send us their information. Who knows? They might make an appearance on the show next week. Also, it's important that you hit the record series. We want to talk to you every week. We're here every Sunday with you at noon. Awesome. All right, everyone. I hope you enjoy the rest of your weekend. We will see you again here next Sunday for Best of Central Florida. Very special show today as we release the top dermatologist in Central Florida. Might I even add, could be a life-changing show for some of us, maybe some of those like me. Can I just start over, please? Please. Very special show today as we visit the top dermatologist in Central Florida. Might I say, could be a life-changing show for some of us. I'll bring in the Michaela Nichols.
Kayla, get on it.